Hi, everybody. Just going to wait for a few minutes for some people to join us. I'm going to share this on my personal. Okay. All right, can you see me? We good?
Yeah.
All right. Hi, everybody. My name is Erica Bailey. I am the Program and Marketing Director at the Max Care Foundation. With me today, we have our Executive Director, Jonathan Egan, and a very close personal friend of mine, Ryan Norton. He is a psychotherapist here with the state of Arizona. He treats the seriously mentally ill community here in Arizona. We wanted to bring him on board so that we can talk about what's happening with this COVID-19 and how it's impacting us as a community on a mental health level. We spoke just a few days ago in regards to how it's impacting the community on a medical level, and now we're kind of expanding that a little bit. So it's more of a fireside chat. We've got a couple of topics we're going to discuss today, and we're open to questions. Anybody who has questions, feel free to put them in. There is a Q&A if you're joining us here on the webinar at the bottom, or if you're on Facebook, feel free to post in the links below or the post below, and I'll be able to see it. I'll be checking it randomly. So without further ado, hi, Jonathan. Hi, Ryan.
Hello. Hello.
All right. So, Ryan, mainly what we wanted to talk about today is how this whole COVID-19 thing is how much stress it's causing on us, and how that is impacting adults, how it's impacting teenagers, how it's impacting children, and what we could possibly do to maybe reduce our stress or pay attention to some of the signals that are saying, hey, you're on overload and this is what you need to do about it. So thank you very much for joining us.
Yeah, no problem. Well, first and foremost, what we're all experiencing right now is unprecedented in most of our lifetimes. And with it, the stress, anxiety, and depression to an extent is it's different than anything that we've experienced. And that kind of unfamiliarity with what we're feeling right now is really causing a lot of people significant distress, for lack of a better term. Our place in the world is kind of up in the air right now. If we think too hard about it and dive too deep, there's a lot more questions that we have answers to. Mm-hmm. And that doesn't help our anxiety levels go down. Mm-mm. And so, yeah, as a people, just on the fly, we're being forced to kind of come to grips with this, process everything, and form a reaction that will be positive and not, detrimental to us in any way.
Yeah.
So it's a challenge.
Ryan, why don't we actually let everybody know kind of who you are and what you do in the state of Arizona, and I think that'll make it clear as to why we asked you to join us today.
Okay. Yeah, so my name is Ryan Norton. I am a licensed clinical social worker in the state of Arizona, which I'm basically a licensed psychotherapist. I work currently with people that are designated SMI or seriously mentally ill by the state. It's a designation for people that need a much higher level of mental health care and treatment than your normal run-of-the-mill anxiety, depression, stuff like that. I work a lot with mood disorders, personality disorders. Trauma is one of my big things. I am an EMDR therapist, so I'm really big on trauma and resolving trauma and how it just affects everybody. But yeah, so I spend most of my time dealing with people who are not in the best place in their lives and are trying to get a leg up and trying to resolve some of the bad stuff that's happened to them.
Got it. And you are actually tasked recently with running a support line for people that are dealing with some stress due to this coronavirus. So how much you been?
Yeah, so I'm part of a team, a clinic. Like I said, SMI is the term. And on our clinic, we have case managers. We have a psychiatric nurse practitioner who prescribes medications. We have nurse, a doctor, and just to offer these people a lot of services that will help them lead a more normal life. And what we're doing is, because of the increased stress and anxiety that a lot of our clients are expressing, we've kind of opened up a support line where people can, not exactly just call me any time of day, because that would be excessive, but they text me and I call them back, and we kind of talk through it about what they're experiencing. And it's been enlightening, to say the least.
Yeah.
Because, it's the things that I'm fearful about with this are not necessarily the same things that other people are.
Yeah.
And that's been kind of eye-opening. So
one of the things you and I were recently discussing is what we know versus what could be. And I'd love it if you would share your insights on that with our audience and our community.
Yeah, so one of the worst parts of human nature is to take a little bit of information and run with it. And when we are in a fearful state of mind, when we're suffering from anxiety, we run someplace dark with that usually. And so what happens is we get information, we can get, excuse me, and I know this is terrible. I have horrible allergies, and I know you're not supposed to touch your face right now, but I just can't help it. So I am home and I'm sanitary and everything like that. So, but no, so we tend to go to a place where we catastrophize, where we imagine the worst. And when the messages that are coming in are, can seem very dire, that doesn't help our natural instincts to kind of anticipate and prepare for the worst, which in some instances that can help us. But in a lot of cases, it really, it throws us off and off balance, and it puts us in a place where we're not optimized to deal with whatever it is that's going to come next, because we are braced, we're tense, we're just worried about the next bad thing happening to us. And everyone has a tendency, because we're trying to process, we want to make sense of this. We want to make sense of something that is really hard to make sense of. So we as humans, we seek knowledge, we seek information. But a lot of times what we're getting, it's just not helpful right now. You're seeing a lot of, you're seeing a myriad of different responses to this crisis. And with that, it can be mixed messages. And that can muddy the water and actually hinder us from processing and making sense of this. So I think really, like, what we really should be careful about is what we take in, how much of it we take in. And, we want to stick to the facts as best we know them. And right now, especially, just keep our focus on what's in front of us and what's close to us. Because otherwise our brains will bite off more than they can chew. And it's not good for any of the people around us.
Yeah, it does. So you're saying we really, as a community, although we want to get all of the information, and I want to open my Facebook feed every 2 minutes and see if there's a new article or somebody else's new post, or that I need to be more selective about the type of media that I'm bringing in, or?
Oh, absolutely. And social media especially. And this is where I'm going to sound like I'm talking out of both sides of my mouth, because it's very important for us to stay connected, but we also do need to filter out a lot of the stuff that we're seeing on social media.
Mm-hmm.
As far as our information about the health crisis goes, we really need to focus on sources we trust and limiting just the amount of time. Like at this point now, I will check. There's a local website one of the local news stations, who does a pretty good recap at the end of the day, and I pay attention to that. And so I'll check it. I'll probably do about 30, 45 minutes of reading the news at the end of the day, just kind of get a better idea of what's happening in the state. But beyond that, I won't check it. I turned off the COVID notifications on my phone. Now, Facebook in general, it's hard. Although I do have a feeling that a lot of us have gotten much better since 2016 about filtering out stuff that we see on Facebook, just from political back and forth. If we can extend that to COVID and kind of just don't take in everything. You can see it, but just kind of scroll past if you can. I know it's hard, but that would be my advice, is really just limit your intake on the coronavirus news.
So do you think that scrolling through these feeds and seeing all of these posts and is causing a severe sense of dread and possibly developing anxiety with adults especially?
No, not to sound like a smart aleck, but I think justifiably the coronavirus is causing this anxiety and these reactions.
Okay.
But our exposure to what's happening in the stories, that's exacerbating it. That's making it worse. When I read about Spain having to open up an ice rink because they're out of mooring space, that doesn't help me navigate my community, my world, what's going on around me. So that's an example.
And so for people like me, one of the things I recognize is that when I'm extra stressed or extra anxious, that I have a tendency to trickle that down to my kids and to the people in my home. What are some things that I can pay attention to? What are some triggers or things I can pay attention to that are saying, okay, Erica, you've had enough. You need to shut this down. Or how do I turn myself from the gotta scroll to, okay, I'm going to put this down and I'm going to look at it once a day and I'm going to focus on what's in front of me.
I think right now, more than ever, self-awareness is very important. One of the types of therapy I do is called DBT. It's dialectical behavioral therapy. Okay. And a lot of it is it's being mindful and also checking in with yourself and your body, right? So, I mean, I've been through this a lot, but one of the things is I do this, like I'll scan my body just with my brain and just notice places where I'm holding tension. And I've noticed, like, the first 2 weeks of when the news of COVID started coming out, I was my shoulders, my chest was really tight, and it was all this just tension, anxiety, and fear that was manifesting. And if we can be aware of how we're feeling physically and our preoccupations as well mentally, if it's hard for us to focus on things. So say I'm making dinner and it's hard for me to focus on that because I'm preoccupied with something I read, 30 minutes ago, that might be a sign that it's getting overwhelming. Okay. Preoccupation, physical manifestation of the uncertainty and the fears that come with it. Mm-hmm. Those are ways that we can check in with ourselves and see if we're taking in too much. Okay.
And if we're taking in too much, what do we need to do? What are some things that we can do to get more, to kind of release that and to get a better grasp over, our own selves, our own body?
Unplug, focus on what is truly important to you, and really just kind of first off, we all, right now, it's very important that we all have what we consider to be a safe space, right? A place where we feel comfortable, secure, where we're not fearful. Like I'm in my apartment right now, and I don't feel afraid, right? When I have to go to the office, that can change.
Mhm.
So if we have that safe space, that's a start, right? So we focus on that. We focus on how it feels to be in there, right? There's a relaxation that you should feel when you're in that space, and it's almost like when you were a kid playing tag. It's like a base, you know, like you're safe. You touch something. Um, but really focus on what's important and what you can control. One of the biggest things that adults, kids, teens, everybody is going to be struggling with over the next, however long this goes, is a sense of lack of control. And there are things that we can control, and it's really good to have daily reminders of that. Because when everything is uncertain, nothing makes it worse than feeling like you don't have control over it. So really focus on what you can control, right?
Even if it's what I'm going to make for dinner that night.
Yeah.
One thing
Well,
that I
absolutely.
can control, I can
Yes.
hold on to that, get through that. I'll start to feel a little bit like the world's not crumbling around me, right?
Right. We have to stay grounded, right? And sometimes that's as simple as, this is a little bit getting into kind of PTSD symptoms, but staying grounded, um, reminding yourself where you are, little things. Have a gratitude list.
Okay.
Something you read that is just, it reminds you, it draws you back to like, this is, this is what matters to me.
Got it.
And it's safe right now. Now granted, it may not be safe, but you want to focus on what you can control. Like I can control who comes in my front door,
Mhm.
right? I can control that everything in my house I know has been wiped down with Clorox, and and I'm not in danger here,
Mhm.
right? I am in control of what I eat. I'm in control of what I watch. I still can mold my little bit of this little space that I have. I can mold this to my liking to meet my needs.
I
Out
like
there,
what you said about that gratitude list, and I'm waiting for Jonathan to chime in and say meditation. Don't forget about meditation.
oh, meditation all day long. Like really, meditation saves lives. It does.
You and Jonathan could probably take the next hour of this webinar probably just talking about that. But okay, so we talk about getting a better idea, having control. I like what you said about the gratitude list. And I actually use this myself as I find when the world is too big and I feel like there's collapsing around me. I'm a mother of four. How am I going to do this? What happens if I run out of diapers? What happens if there's no milk? All of those things. I find myself not knowing what I can be thankful for. So when I have to physically sit down and write, even, I'm thankful that I have toilet paper. I'm thankful that there is food in my fridge. I
Yeah.
start to recognize that the list gets longer and longer and longer and longer, and the ones that I'm afraid of get shorter and shorter and shorter. So it helps me tremendously, and I do that daily.
Right. And the phenomenon associated with that is all humans do this thing called filtering, where, and this goes back to being careful and selective about what messages you take in. Okay. So if I'm in a very fearful frame of mind as far as the outside world, that is a very big distraction. And the messages I take in will tend to reinforce that mindset that I'm in. Right. And it's hard to be grateful when you're afraid of, like a virus, creeping under your door. But so if you do have a list and you can just read it and really be in the moment, be mindful, like be present when you read that list, that helps. It slows things down and it really can give you some clarity and perspective. And that matters when we're really stressed out. It's kind of like a pause button to say, you know what? This is this other crap is scary, but this right here, this list in front of me, this is what I have, and it's good.
That sounds good. Okay, well, that's good information to have. My next question for you is specific to, now I understand what to look for me, right? I can feel the physical manifestation of the anxiety and of the grief and of the depression and of the social distancing. I can recognize my own triggers, but how am I going to see them, or what should I be looking for in my teenagers, in my 12-year-old? Like, how am I going to see what they're physically feeling inside? As a parent, what should I look for?
Well, again, I'm not here to tell anybody how to parent. You know me, I'm not a parent. But I would say that if you have kids, there's a very good chance that you are in tune with them, that you know them well enough that if you are, and again, this is another reason to stay in the present, stay within yourself and not get too distracted by COVID. If you are present, there's a really good chance that you can pick up on behavioral changes and notice when your child is carrying something, some emotion that is just, you can tell something's weighing on them. And again, this is another huge reason why it's great for us to stay present, okay? To stay grounded with our families. Because when a kid, because children, especially teens, they're going to present these things, these different reactions in all kinds of different ways. Some are very vocal. Some are going to be very quiet. Some will isolate more, but they're already teenagers, so a lot of them already are isolating. So it really, I hate to say this because it sounds like a cop-out, but it is basically on a kid-by-kid basis or a teen-by-teen basis. And it's up to you to kind of decipher that. But I really, any kind of abrupt behavioral changes would suggest that they are struggling to process something. So,
And what's the best way? I mean, I know you're not parenting, but I mean, what's a good way to approach it? I mean, I can't tell my 12-year-old the same thing that I would say to you, right? Like there's different ways to address it with our kids, right?
Yeah. Well, yeah. And again, I don't want to sound like it's a cop out, but every kid has different communication styles. Every human being has different communication styles. And if you're able to, kind of find out what works best for them, how to approach them. But always, I preach honesty with them. That being said, you may, especially teenagers, because teenagers are going to be hearing this anyways. They're going to be picking up on, as much, if not more than we are on social media. So it helps to be honest with them because they will know if you're not, and that will tank any communication you have.
Okay.
But really just approach them with honesty, and even for teenagers, I think at this point in time, it's beneficial to kind of reassure them that you are a defender, that like they're defenders. Like a teenager may not be willing to ask you for that kind of help, but it can reassure them. And just knowing that you really are there and that you are taking this role seriously as, kind of the person who's going to look out for them.
Fantastic. Thank you. Jonathan, I know that we had a couple of questions. Were there things that you'd like to ask or bring up?
Yeah, obviously with what we do at the Max Cure Foundation, our focus is on children with cancer. And our mission gets us involved with funding research and advocating for policy change on the state and federal level. But one of the other things that we do is we fund and provide financial assistance to families, low-income military and first responder families with a child neck treatment. And, as I'm watching everything and everything you're saying about the news feed and what is filtering into our lives and what we allow to filter into our lives, from perspective of a parent with a child with cancer, it's so overwhelming and anxiety producing that I'm worried about the stress levels of the parents who have a child that might be on a chemotherapy drug that reduces their immunity or requires them to be in the hospitals, and all these hospital workers are being their lives are being put at risk minute by minute, and it's I can't imagine the anxiety in those households, and kids feel that. Kids can sense that and feel that. What advice can you offer parents that are in an even higher state of anxiety at this point because of all of this?
That's a really good question without a really good answer. No, I want to be careful because I don't want to, spread misinformation or anything like that. And I don't want to give people the impression that everything is okay. Because if you are immunocompromised, I'm immunocompromised to an extent. Like not as much as a child going through chemo. The stress and importance of that really, really escalates things. And I think it is it is almost impossible to keep that from seeping into your home and your family. Just that elevated anxiety and stress. And I think the best way to deal with something like that is to have a strong backbone built on protocol and routine. And it's kind of like a fallback. Like we are all, by now we should have a pretty good idea what the COVID protocols are. And if somebody's going through chemo, they should know what the protocols are for keeping somebody safe that's going through that. And those kind of have to be the backbone of the daily life. And I can't imagine how much stress that puts on a family, truly, but it is, in a sense, it's safety. It's this vein of safety running through everything that we do just to keep our loved ones safe. Now, as far as keeping anxiety levels down with children in the home, again, parents have to be able to take care of themselves. Talk openly and honestly with your children, about the importance of what they're doing and why they're doing it. But you really have to be in a pretty healthy place yourself as a parent, I think, to answer those challenges. So do not isolate yourself. I know we're supposed to isolate, but the three of us right now, we are physically isolated, but we're not, So it's to have a team, right? Connect with other parents if you can, right? There are, Zoom, the use of Zoom has increased like 1,000% this week, and with good reason, because we need to be able to do this stuff, right? So if we can have, the importance of keeping our support system intact, even virtually, will pay dividends for months and months and months. Like, it is really just that kind of acceptance, understanding, and a sounding board at the same time. It's kind of all these things wrapped up. So our family, our not necessarily our immediate family, our extended family, friends, neighbors, people like, people that you've met through MaxCure that maybe you've bonded with, and you can, you have a camaraderie there. Those kinds of things can really help us, keep our sanity, and it really does matter, because I think one of the biggest risks for a parent going through something like this, even if you're married, the feeling of being so completely overwhelmed by what's being asked of you has to be daunting and just almost crippling at times. So we really need to be able to, we need to keep those connections going with the people around us. We need to stay focused on what's right in front of us that we can control, and try and stay grounded and not get too wrapped up in what's going on.
Yeah, this past week, it really struck me where my head was at, and I think I shared this with you prior to starting. I've been kind of watching this storm rolling in for several weeks now, and worried about keeping Max Cure going as every other nonprofit is, and trying to figure out new ways to raise funds to support the families that we provide assistance to. And as events are being canceled, and this week, it really struck me, one of the things that I'm personally dealing with is PTSD as a result of losing my daughter to childhood cancer and other people close to me. I think that we're going to be dealing with this for a long time to come, unfortunately. But for adults and parents and caregivers that have been through, the diagnosis of a child with cancer, loss, or for survivors, there is such an added sense of trauma at this point that, what as parents and caregivers should we be on the lookout for ourselves, so that we that aha moment kind of gave me the ability to go, wow, okay, I permission to be human.
Yeah, absolutely. PTSD is one of the most devious, insidious things that a human being can deal with. And you really do have to be aware of the signs. Isolating, irritability. There's a lot of mood components that can go into it that can seem very small and, like you said, human. They can seem normal given the stressors that we're going through. But when you couple them with, flashbacks, and with PTSD, a lot of what people will notice are the physical sensations. If something triggers, one of your traumatic memories, there will be a lot of physical sensations associated with that, and that can be very unsettling to the point where it's you kind of want to hide out. It's noticing them is one thing, and having the outlets to do something about it right now is something else. For anybody that has been through that kind of loss, that kind of trauma, I highly recommend that. Obviously therapy is wonderful for everybody, but for people, especially parents like that, it's almost necessary. But again, in this time, it's really hard to find a therapist. If you don't already have one, I'm working from home right now. I'm doing all phone and video sessions, just because of the risks involved. Like in my clinic, I'm trying to reduce traffic into the clinic because these are all highly vulnerable people, and I don't want them, possibly exposing somebody else, or a staff member getting infected, which is, I think, my big fear, and then being asymptomatic and passing it on. So, but there are therapists out there who are taking clients just for something like this, like video sessions. And you're not going to get into the real big trauma work, like the PTSD really necessitates, but it's an outlet. It's someone to go to talk things through, right? And that's, again, if we don't have access to that, that's when those peer connections can really help us, right? But familiarize yourself with the symptoms, hypervigilance, isolation, irritability, it's night, sometimes, hopefully not, but, night terrors and stuff like that can come with, when your PTSD is triggered again. And to somebody who doesn't have supports in place, I would suggest to them, do everything you can to stay present and grounded, right? If you notice yourself starting to get taken away by these feelings, then there's a couple things that I would recommend you have. A list of things to distract you, a distraction list, okay? It can be anything from doing a puzzle, maybe playing with a pet, okay? Organizing something, right? Making dinner or something, people say that can be fine, but you want to be careful about giving your mind space to roam. When I cook, my mind floats, and my meals taste like it. So, but it like so like but if and music, be careful about music, because music is one of the biggest triggers that you will ever come across, right? So for me, it's something as stupid as a Sudoku puzzle or whatever, Sudoku, like just puzzles, organizing things, keeping busy with my hands, like actual physical puzzles can help, but it's something to really force your mind out of where it was when you were kind of immersed in the traumatic experience, the traumatic memory, right?
Yeah.
It can be as simple as stomping your feet on the ground just to remind yourself where you are, and then implementing a distraction list can really help.
Yeah.
Good.
What you said really, I've noticed that in communicating with people, human beings, on this level, the way that we have to now, and we did another webinar before with a childhood cancer researcher who is a childhood cancer survivor himself, and just being able to talk and hear and talk through things is the sense of community when we can't have the community that we have around us is very helpful. And it's one thing within the childhood cancer community that is very present. There are so many different, Facebook pages and message boards and all that stuff. But I think something you said initially, in response to a question that Erica asked you about the information that's out there is, I think you hit the nail on the head. Filtering out what you should let in and what you shouldn't let in. Social distancing should also include social media distancing as well. Because people have all different views, and I'm still seeing people out there that are saying that this is nothing more than a cold or a flu. What are we all worried about? Death toll, all that stuff. But you're talking about a community that lives with the constant specter hanging over it of, is my child going to live or die? And they see their child being intubated for an MRI. They see their child being intubated for surgery. And, I got to tell you, my God, the first week and a half, 2 weeks, as the storm is starting to roll in, I'm reading all the stories about, all of that. I'm panicked, absolutely freaked out about all of it. And, this is such a vulnerable community. It's, everything that you're saying makes so much sense.
It is, and especially, and this is something actually I forgot I wanted to mention, but given this community, that control, that sense of control is so important, because, like you said, the differing responses is, I've been paying attention to, right? So I've been taking this very seriously. I have a friend in Rome who actually Erica's friends with too, and we've been discussing this stuff, and I've been taking it seriously, and yet for me, I go to CVS to pick up my decongestant, and there's somebody very blatantly not taking it seriously, and that's a trigger to me. Yeah. And we have to be, if, in a situation like that, you can turn around and walk out. Like you have some control over the situation you put yourself in, and don't be afraid to take the long way, the long way around. If what you see as a threat is there, just because somebody else doesn't take it seriously doesn't mean that they have to threaten my security and my safety and that of my, of your children. Like we have to exert more control in that sense, because we have to be able to step in and say, no, I'm not going to let this person, just because they, watch a different news channel,
Right.
that I'm not going to let them, endanger, what I love. And so it's a lot of, and socially, humans are so awkward in that way. So many of us are just, we don't want to rock the boat. We don't want to cause a scene or anything like that. But you know what? This is about our choices and the choices we're making for other people, and it's okay to be the difficult person, right? It is okay to take it seriously when maybe nobody else in the room is. Okay, you are justified in that. You are validated in that, because this truly is important. And eventually, unfortunately, all those people are going to see that they should have been taking it seriously.
Yeah.
Yeah.
Let's make sure we get to the rest of the questions here, as we're getting close to cutting off for today, but we could definitely do this again in the future. Jonathan, I know you had some other questions pop up.
Yeah, one of the biggest anxiety producing feelings at a time like this is just the lack of certainty. And when you have a child with cancer and they're on a therapy regimen, there's a certainty to it. And there's a certainty to, okay, on this day they are going to the clinic, on this day they're going to here and here. And in our community, there's also a sense of security in the routines of being at the hospital and those institutions. And so, now with so much greater uncertainty in the world at this point, I mean, do you have any suggestions for how we can try and gain as much certainty in our little micro environments as possible? I mean, you've suggested some, but how do we gain certainty in this time?
Oh boy, no, no. It's an excellent question. It truly is, and I think there's a couple of different aspects to it. Like you said, there's children thrive on routine and structure. Okay, and again, if we're introducing a child to COVID precautionary measures, that might be able to be built into the routine, the protocols and stuff like that, and just hopefully it can just become part of the process. But I know one of the things that Eric and I talked about, and I think you touched on it too, was the actual treatment itself. Like if your child has to go to the hospital right now to get treatment, that opens up a whole nother level of concerns right now in a situation that used to be very reassuring. And I think those concerns really need to be expressed to the medical team. I would hope that the staff would be able to make some kind of accommodations just to extend that the security and the reassurance that can come with that. But again, it also calls for just more rigid sticking to what it is that is keeping them safe. Like the protocols, the precautionary measures. And I don't think it's inappropriate for a child to understand how important that is. And it doesn't have to be fire and brimstone, but just for them to understand that this is very serious, and this is what we have to do, and it's unpleasant. But for right now, this is the way. This is how we get through this.
So when these kids' routines get kind of, I mean, I don't have a child who is battling cancer. I've just been introduced into this world 7 years ago when I even learned that cancer existed in children. But for example, my children their routine of going to school every day. Most of our kids' routines of going to school every day is now gone. They don't know when they're going to see their friends again. They don't know when they're going to, be able to see their teachers again. And that structure is now changed because now they're at home with working parents that are trying to get jobs done at home. And so their lives are kind of thrown up in the midst. And this same thing happens when you're in treatment. So I'm assuming treatment protocols might be changed a little bit based off of the needs of the child. So maybe they can't go to the treatment center to get, their treatment anymore and see their friends. So now they're already dealing with that stress, and it's just bubbling up and bubbling up. So I can see how it could be definitely negatively impacting.
Yeah. And again, you might have to think outside of the box a little bit. So say a child is going for treatment and they have treatment friends, maybe they have to split up and go different places. Well, maybe they can FaceTime during it, just stuff like that. Like just to, like, as important as the connections are for us as adults, they're important for the kids too. And just that familiarity and that kind of thing is, just something that they know and understand can really help them.
And for anybody watching, I know you FaceTime, there's Google Hangouts. Zoom also has free services that you can use. There's free conference call lines, resources out there that will FaceTime, Messenger, Hangouts that will allow you to be able to set up those things. And they're becoming more and more available to the community at large versus just businesses like, for example, for us.
One of the things that you mentioned also was the topic of grief. And, I think it's so powerful to acknowledge that we are all grieving at this point in time. And I think there's power in that joint acknowledgement. And for those who haven't experienced grief and the stages and everything that's associated with that, I think just acknowledging it is huge. But what should parents be on the lookout for in terms of their own grief and how to process it so that it doesn't impact everybody too heavily?
I would say first and foremost, what we need to keep in mind, and this can really help us as far as the community goes, is that, like you said, we are all grieving multiple losses. The life we knew, where we thought we stood in the world. And a lot of it is anticipatory grief, like what we're grieving for the future, because what we thought we knew about tomorrow now could be up in the air. The important thing to remember is that everybody around you, kids, teens, adults, we're all going through the stages, but we are all going to hit them at different times. So kind of learn them, and just be prepared for people's reactions, especially anger, denial. Those are the ones that are going to make it harder for people who are in, like, you're fairly accepting of where you are right now. And that's really good for you. But when you encounter someone who's angry about it or in denial, that can to trigger you and throw you off. So we have to be careful.
Yeah, I think it's a really good point. We are so divided as a society along so many different lines, and I think social distancing now, from a physical standpoint, is obviously what we need to be doing, and hopefully in retrospect, because the mass the masses will be doing it, we can get through it easier. But, social distancing away from people that are, really trying to trigger and attack you and attack what you're trying to hold on to when so much has been lost, I think is also very critical at this point.
It is. We need to keep an eye on that. We need to figure, just the general awareness, and not, we don't have to fix everything, but just being aware of it can give us an advantage just in how we deal with our neighbors, the people next to us. And I do think you will start to see that, as we progress. It is, you will start to see understanding kind of hopefully lead the way in our interactions. And because we're trying to, not only individually do we have to move forward, but it's, collectively. We need to figure out what this means for our communities.
Yeah.
And we're all in it together. And I think people are starting to realize that.
Wonderful. Okay. Well, Jonathan, is there any other questions? I think we should be wrapping this up here shortly. So did you have anything else that you wanted to discuss, or any other questions you saw?
I think that the themes that we've talked about here are applicable to all of us in general. But, to our community in particular, I think we need to all be more vigilant and check in with families and parents, and check in with the clinicians, check in with the nurses, check in with everybody, just to make sure that they're giving themselves that permission to be human and recognize what they're going through. So, themes that you've outlined and discussed, I think, are so critical now more than ever. So thank you.
Yeah, thank you, Ron. We really appreciate you taking the time to talk with us today. Hopefully we'll be able to do this again in the near future as we get more questions and stuff from the audience. And we appreciate everybody joining us on the webinar today, both from Zoom and on Facebook. We hope that we've been able to bring you something.
Yeah, you guys are welcome. It's an honor to speak with you today, and hopefully I could be of some help. Both of you, Jonathan and Erica, what you guys do is fantastic. And I can't thank you enough for everything you guys give. Seriously. So thank you very much.
No, we appreciate your time and your wisdom. So thank you.
Right. We will be putting this up on YouTube too, everybody. So I'll share out the link on social media and email soon.
All right.
Good weekend, everyone.